Good afternoon, everyone, and we certainly hope you had an enjoyable 4th of July weekend. As we return today, we're going to update you on some of the important news that has transpired over the last few days, and unfortunately, I have to tell you, it's not good news. If you recall, at our last briefing before the holiday, we discussed the growing possibility that our county of San Diego will be placed on a state watch list that could lead to the return of some of the restrictions that we have had in the past. Counties placed on that watch list by the state wind up there because of a series of metrics that have been reached that show the spread of coronavirus is still growing. Over the weekend, our numbers continue to grow in the wrong direction, with 489 cases on Friday, 468 cases on Saturday, and unfortunately 562 cases reported yesterday. As a result, at midnight tonight, our public health order will be updated under the state's directive, and we will close all indoor activities at the following businesses and establishments: restaurants, bars, card rooms, wineries and tasting rooms, theaters, zoos, museums, and family entertainment centers, indoor activities. This order will be in effect for the next 3 weeks. The intent here is to slow the spread and reduce the number of cases over the next 3 weeks to get a better handle on this virus. Supervisor Fletcher and Dr. Wilma Wooten will go into more details about the updated public health order and what we will be allowed under certain restrictions. With that, let me turn it over to Supervisor Fletcher.
Thank you, Chairman Cox. We're here today, again, as was mentioned, and no surprise, to share that we are officially in the period of corrective action as outlined by the state of California. Today in San Diego County, we topped 17,000 total coronavirus cases. And in the last 10 days, perhaps in the last 2 weeks in particular, we've seen a concerning rate of spread. A rate of spread that has not only impacted our county triggers that we monitor on a regular basis, but also the state triggers that we monitor and track in real time. And so because of that, because of the 6-day period on the state monitoring and state watch list, today we are in a position where we're forced to implement their directed restrictions or dialing back. Throughout the beginning of this, we've said as we move through this process, we'll have to constantly monitor and we'll have to constantly adjust what we're doing. And so now, consistent with state guidance and with the state order, we are making the appropriate adjustments. You know, if we go back and we remember the overall strategy, I'm reminded of the phrase, hope is not a strategy, and we can't simply hope for the best. We have to put in place a series of measures that allow us to guide our way through and slow the spread in a responsible way to help us manage and mitigate through this, preserving as much of our economy and large sections of what we hold dear as possible. In April and March, in particular April, we came together with a month of action to flatten the curve. We did that incredibly successfully as a region. That bought us time to build up our healthcare system capacity, to build up our testing capacity, and to move into May. May was a month of adaptation as we began to adapt our behaviors, as we started opening up parks and beaches and outdoor opportunities. We talked about the vital importance of things like face coverings, which as a county we implemented early. We talked about the importance of physical distancing, hand washing, and of course the vital testing, tracing, and treatment or isolation strategies. That gave way to June, where we moved forward into the reopenings of our economy. But a large part of that strategy and effort was the introduction of the metrics, both what we monitor here in San Diego County, along with what the state of California monitors, to give us early warning signs that things were not headed in a good direction, and give us the ability to make adjustments in terms of turning the dial to try and get them under control. I would remind everyone that hospitalizations and deaths and ICU utilizations are lagging indicators of positive cases. And so it's important that oftentimes we take action when it may not appear from a hospitalization or death standpoint that we need to. I've spent a lot of my life in the mountains, both in the Marines and hiking, and we often say when it comes to hydrating, if you wait until you're thirsty, it's too late. And the reality is if you wait until your hospitals are overwhelmed, it is too late. And that's why these metrics are put in place to give us a guide as we work our way through this. But I think it's important that we think about the coronavirus pandemic as a daily fight that we are all in together. We are in a fight to slow the spread of coronavirus. And we win that fight by physical distancing, by utilizing face covers, by hand washing. We win that fight by adhering to the public health orders, all of us coming together collectively to keep our numbers in check. We fight every single day to preserve the integrity of our healthcare system. We fight to save lives. And we have to fight to slow the spread to save our economy. The most important thing for our economy is that they have a smooth and steady reopening, which is why we have to fight to make sure that the cases and hospitalizations and all of the various metrics we monitor are also smooth and steady. If we can come together and avoid significant spikes, then we can avoid the types of situations that we're in today. And so now we have to recommit ourselves. We are where we are today. We're certainly not the only place. The majority of the state of California is in this situation, and countless other states throughout the United States are in a similar situation where they are dialing back or changing particularly higher risk endeavors. Some of them, because their spike has been more significant, are supposed to have more significant dial backs. And we certainly don't want any business to be negatively impacted. And this is something that we had all hoped to avoid in terms of having to dial back. But if we can make some modest adjustments now, get these numbers under control, then the hope is that we can resume and begin to move forward together. We came together tremendously to flatten the curve. Now we have to come together to slow the spread. And we have a period of time throughout July to go out and get these numbers under control and put ourselves in the best possible position to be winning the fight against coronavirus moving forward. Per the governor's orders in the state of California, we are now one of the 23 counties in California that are required to take corrective action. And so starting at midnight tonight, 12:01 a.m., the following changes must be put in place. The dine-in sections of restaurants, bars, breweries, and pubs that serve food will be closed. They will be limited to outdoor dining only. In addition to outdoor dining, of course, they can do pickup and delivery, curbside, and takeout. But any area of a dining establishment that sells food must cease on-site food consumption by 10 p.m. with all customers out by 11. Now, takeout, delivery, drive-through, those types of things that don't have the on-site consumption are free to continue on a 24-hour cycle. Bars, breweries, brew pubs, and pubs that do not serve food must close all operations, even if those operations are outdoors. Now, if you are a brewery, brew pub that does not serve food, you are still allowed to do curbside sales of your products, both to allow for pickup of your products. Wineries and distilleries in the state order have been separated from bars, breweries, and brew pubs. Wineries and distilleries must close indoor operations, but are allowed to have outdoor operations with all appropriate modifications that have been outlined. Movie theaters must close indoor operations. Indoor operations of family entertainment centers, bowling alleys, batting cages, arcades, the indoor function of those must close. Zoos, outdoor activities are allowed, but any indoor zoo facilities may close. I've spoken to the San Diego Zoo, and they think this will have a very minimal impact on what they're doing. Indoor museums must close. Indoor card rooms must close. And we certainly understand the impact this will have on restaurants and businesses, many of whom just reopened a short time ago. These are not decisions that anyone takes lightly, and they're not decisions that are not taken understanding the very difficult strain and stresses you're under. They are decisions that are put in place and designed in order to slow the spread, to allow us to continue to move forward and allow us to try to get this under control so that we can get large sections of our economy back up and running successfully. We talked from the very beginning that these metrics, again, were put in place as early warning indicators of things we needed to do to try and get it under control. And I know all of us here in San Diego are committed to the same fight, preserving life, preserving the integrity of our healthcare system, and preserving our economy and our jobs. And again, the two are not mutually exclusive. We must slow the spread of coronavirus in order to allow our economy to open and thrive. We took some actions last week because we hit our county triggers, and today we're here taking some because we hit the state triggers. And we will continue to monitor each and every day everything that we look at and we see, and we will, of course, continue to urge the public to be mindful of our individual actions. We all have tremendous ability to make conscious decisions about the actions that we take that can contribute greatly to what we're doing. Please wear a face covering. Physically distance with non-household members. Avoid large crowds, particularly indoor settings. Indoor settings, I think, consistent with the state guidance and what we've been doing, are the ones that are most problematic and most concerning. And let's do our very best to get through this together. With that, we will jump into our numbers today with an update on our charts. We will begin with our T3 testing, tracing, and treatment. I would like to say a special thank you to the county staff and many of the health system staff who worked through the holiday weekend to continue to administer and process testing. Today we're reporting 7,667 tests. Usually on a Monday we see a significant drop. We did not this weekend. So we continue to have our 7-day average be well above our initial goal. And you see our contact tracers there, investigations being performed, and our public health motel room treatments. Today for cases, I mentioned we're at 17,000 total. Our numbers today are down a bit, 274 positive cases out of the 7,667 I mentioned, for a 4% percentage of positive. This is just a little bit under our 14-day rolling average. So we will continue to monitor, but certainly better numbers today than previously. Hospital daily census is basically unchanged. ICUs are up a little bit for COVID. Non-ICUs are down a little bit. Again, I would remind everyone hospitalizations tend to be a lagging indicator. Period of time after you see an increase in cases is when you're likely to see an increase in hospitalizations. We keep going down here. The next one will be our hospital census. Again, you see our ICU numbers virtually the same. Non-ICU down just a little bit there, 3811, well below our 80% capacity, just under 5,000. And then the next one is our ICU utilization. COVID numbers up just a little bit, non-COVID down a little bit, still hovering right there at 70% of our ICU utilization. That concludes my section of the report, and I'll now turn it over to Dr. Wooten for her public health officer's update.
For your update today, and welcome everyone to today's briefing. On the first slide, we show our global, national, and state statistics. That information is obtained from the Johns Hopkins dashboard, and you can Google that just to keep up with those data that are updated fairly frequently. I'm going to focus today on our San Diego County statistics reported at it's actually through 11:59 yesterday and reported this morning. We were reporting 17,000 cases, which is 274 more cases than reported yesterday, and also includes 387 deaths, with no new deaths reported over the weekend. As a reminder, over the past 3 days, from Friday through 11:59 Sunday, the county has reported 1,304 new cases, 468 for Friday, 562 for Saturday, and 274 for Sunday. The age range of cases still remains from 3 months to 102 years of age. 57% of the cases are in the age range of 20 to 49 years of age. This overall percentage is continuing to increase from just over 50% at the beginning of the pandemic in March to now at 57% after 4 months. 8,652 or 51% of our cases are female, 8,223 or 49% are male, and only 125 individuals did not report gender. 1,912 or 11% of cases have hospitalized. Now, while this hospitalization number is decreasing because it has been as high as 20, we do feel that no, the data shows that in the past 2 weeks to a month, the numbers have increased. 516 of the total number of cases have been admitted to the ICU. This number is 3% of the total number of cases and 27% of the total number of those hospitalized. Regarding deaths, there are, again, as stated, 387 total deaths, which represent 2.3% of the total number of cases, which is decreased from 4% over the past few months. 43% of those who have died were female, 57 were male. 367 or 95% of the total death cases had underlying medical condition, 19 or 5% did not, and 1 is still pending confirmation. And as always, our sincerest condolences and sympathies go out to the family members and friends of all of the cases that have lost their lives due to COVID-19. Now, in the next set of slides, we will show test cases, hospitalizations, ICU admissions, death data, and the epi curve. This slide actually shows our test, and we've been doing very well with tests performed throughout the community over the past 2 weeks. Next slide. Actually, let's go back to the last slide. Just want to point out the fact that in stage 3, the goal was 2 tests per 1,000, and I think we are well above that even at this point. Next slide. So for new cases, we have shown over the past 2 weeks, we have had the highest number of daily cases, with our highest reported on July 1st with 594 cases. But we've been, since I believe Wednesday, the 25th of June, above 400 with the exception of 2 days on June 29th and yesterday, July 5th. Next slide. So this slide shows hospitalizations, and you can see a kind of a wax and wane, but actually the hospitalizations, particularly in the last week, have been anywhere from 13 up to 30 hospitalizations on any given day. And the next slide shows ICUs, which are a subset of hospitalizations, and the trend here has also been keeping up, particularly in the past week. The next slide shows deaths, and as is always reported, on the weekends we don't, the deaths aren't reported, so we see them during the week, usually from Tuesday to Thursday. So last week, the number of deaths overall were greater than the prior week. Deaths lag behind hospitalizations, which lags behind cases. So we expect that this lag occurs, and this is the same pattern that occurs for influenza. Next slide shows our epi curve. And you've heard me say previously that we had peaked from March 20th through May 8th, but with the reopening of various businesses, we are now seeing increased cases due to individuals being out in the community and interacting. So these numbers are much higher than were previously expected, even though we expected the numbers to increase. And keep in mind that under the bar, we expect new or additional cases because that's the incubation period. So we expect that we will have more cases in that time frame. Going to the next slide, we're going to now talk about outbreaks. So since the beginning of COVID-19, go back to the seal, please, thanks. Since the beginning of the COVID-19 pandemic in San Diego County, we've had 168 outbreaks overall in congregate settings, which is divided into SNFs, skilled nursing facilities and non-skilled nursing facilities, as well as the third bucket of outbreaks is with community settings. And the community setting outbreaks are related to our triggers. Of the 168 outbreaks, 79 or 47% are now closed, which means the outbreak is inactive and has not had any new cases in the past 14 days or longer. Of the 168 outbreaks, 89 or 53% are still active. And of this 89, 23 or 26% are in our San Diego skilled nursing facilities. And we have a total of 86 in San Diego. There were no new outbreaks reported since yesterday in SNFs. For the non-SNFs, we have 30 or 34% of the 89 active outbreaks in this category. We had one new outbreak reported since yesterday. And lastly, in community setting locations, we have had or currently have 36 active or 40% of the 89 active outbreaks. Now, since yesterday, we've had one new confirmed outbreak reported and one outbreak that became inactive, so that's a draw there. Now, in discussions about outbreaks, this now leads us into our discussion regarding our triggers. And if we can show the next slide, for our triggers, we have them identified here. We changed trigger number 1 and number 10 to be consistent with the state's metrics, and the case rate number 1 is the trigger that has us on the state's watch list. But we also are concerned about our community outbreaks, and we will review those in a minute. And then the third trigger that is abnormal is case investigations, and we will also review that. So if we go to the next slide, this is an overview of outbreaks so the trigger here is 7 outbreaks, no more than 7 outbreaks over the past 7 days. And obviously, we have 21 outbreaks in that time period. And you can see that on July 1st, we had 10 outbreaks, community setting outbreaks reported, 0 for July 2nd, 2, 1, and 1. And then you see the others before July 1st. So every day, the last day drops off. So tomorrow, if we get no new community outbreaks, we will have 4 that drop off. So that will drop us down to 17. But we anticipate that we will get more community setting outbreaks. If we go to the next slide, just before we go to that slide, I just want to talk about, actually, if you can go forward, there should be a table. Next slide. These are not quite in order. There should be 2 tables, if you can go back to the first slide. There should be 2 tables that list the outbreaks, the community outbreaks, and unfortunately, they're there, but not in the quite order. So I think staff is trying to get those for you. So I just want to talk about the case rate, which is what we changed trigger number 1 to. Again, that is the metric that the county has placed the county on the state watch list. This metric is calculated. It is the number of cases over the population times 100,000. So that's how that metric is calculated. Trigger number 2, as I stated, is related to community outbreaks. So that's the number of outbreaks in the past 7 days. And again, we have 21, 2 less than yesterday, and 1 added today. Are we there? Okay, can you go? There we go. So this slide and the slide afterwards shows the 20, it shows the outbreaks that are currently in the past 7 days, and I apologize, but the top is incorrect. It should be 21 outbreaks in the last 7 days. So again, if you go to the next slide, it lists them. It shows the number of slides. So 16 of these community setting, there you go. 16 of these community setting outbreaks are in restaurants. And this is 76% of the total number of the community setting, 16 out of 21. So again, this supports the actions that we are taking today and that are being imposed upon us by the state. So if we go to the next slide. Go to the next slide, please. So the slide with the bars on it, sorry. We were there before. There you go. Okay, so this is trigger number 10, which is the focused on case investigation. And when the trigger here is if it gets below 70%, it is abnormal. And as you can see over the past week and a half or so, it has been abnormal, actually over the past week since June 29th. We don't, actually June 20 or June 30th, where we were at 69%. And that is below the 70% target for this. And this is because of the increased number of cases. Going back for the past 2 weeks, in the middle of Wednesday, June 25th, this was the first day we had over 400 new cases, and we've continued that trend primarily with the exception of 2 days. On the 29th, we had 317, and on the 5th, yesterday, we had 274 cases. But as you can see, since the 29th, the case investigation percentage, which is a case being contacted within 24 hours, the contact initiated within 24 hours, that has declined. We are mitigating this issue by maximizing all of our staffing resources, bringing on additional staff that was already in the pipeline to be hired as case investigators. Case investigators are nurses or epidemiologists. They interview the case first and identify contacts and then hand those contacts off to our contact tracers. So we will continue to closely monitor this, and hopefully in next week we will begin to see these numbers go up as we bring on additional staff. So in the next slide, so the state of California added San Diego County to the state's watch list on Friday. The county continued to be on the list for the last 3 days, requiring the county to be added to the list of counties that have to close indoor businesses for restaurants, wineries, tasting rooms, movie theaters, family entertainment centers, zoos, and museums, and card rooms for the next 3 weeks. And the red column, that is our trigger number 1 that I showed you earlier, and this is the metric that is abnormal. Cases per, or the case rate per 100,000 for the last 14 days. And so it has been greater than 100. And that is what has landed us on the state's watch list, again, because of the increased number of cases. And if we go to the next slide, I just wanted to share with you the process so that everyone understands. We were initially on, we were flagged for 3 days, then we were placed on the watch list, and then we had to be on the watch list for 3 more days, permanently placed on it on July 3rd. If we go to the next slide, July 3rd through July 5th, if we continue to be abnormal, this would put us on the state's watch list for the next 3 weeks. So if our numbers continue to rise, if they decline, we could potentially come off on July 27th. But we will continue to monitor the cases to determine what the future holds. And I believe that is my last slide. Thank you. So I just want to leave everyone with this last message. And I say this at every briefing, but I cannot cannot continue to emphasize this enough. And that is, it is important for everyone to really understand that the pandemic is not over. The virus is still in our community, and it is still widespread and responsible for the increased number of cases. So whatever your age group, whomever you are, we want you to practice the guidelines that we have promoted throughout this pandemic. The first is practice good hygiene and sanitation, practice social distancing, wear your facial covering, and please, please, no gatherings, and if you do, please adhere to those guidelines. So now more than ever, it is very important that we all take our precautions and that we play our part, because everyone does have a role to play. So I now would like to welcome Supervisor and Chairman Cox back to the podium. Thank you so much for your attention.
Okay, we'll go right to the questions.
Bridget Naso with NBC7. Please state your question.
Yes, thank you. I'm curious, now that we have reverted back a bit, other areas in California, some cities are actually imposing fines for people that don't comply with a mandatory mask order. So has the county thought about taking other steps besides closing restaurants, which you can clearly see has made an impact on the number of cases, moving towards something like that, because the governor has said that he is going to or could also issue some sort of penalty to the county financially if counties don't comply.
Okay, Dr.
We
Wooten?
thought about moving to something where a system where people could be fined.
Okay, Dr. Wooten's going to respond.
That's an important question, and one that's frequently asked. As you have heard in the governor's briefings, the state actually have teams that are going out into communities and imposing enforcement, if you will. We are looking at opportunities to utilize other types of staff that we have not used before for this, so we will be working on developing a plan in the coming weeks. We actually, however, encourage, as I stated, everyone has a role to play, and we certainly don't want to fine people, and if they follow the guidelines, that won't be necessary. So in the most part, most of our businesses have been very cooperative, but we know there are some that do not follow the guidelines. So everyone can play a part. If you see something that does not meet our guidelines, let us know. We encourage businesses to take responsibility and enforce the guidance, and then we have law enforcement in the various municipalities to do the same. So again, everyone has an important role to play in helping to enforce these guidelines and the health officer's order. Thank you.
Okay, next question.
Brandon Lewis with CBS 8. Please go ahead.
Yes, I have two questions. The first is we've received a lot of questions from our viewers about why gyms, hair, nail salons, and spas can remain open. And I know it's not part of the state's guidance, but could you perhaps explain why the county isn't taking any action further to restrict any of these businesses?
Okay, Dr. Wooten.
I'm sure many people might be confounded by that, but we try to follow the data and have our decisions be data-driven. So as you heard in describing the community settings, 76% of community setting outbreaks are in restaurants/bars. Have not yet identified outbreaks in very many. Actually, I don't recall actually any to date. I need to go back to clarify that. But most of our community setting outbreaks have been in restaurants, so that's where the focus is. And also, we know that salons utilize face coverings. They have shields and barriers. So, and there's been actually some anecdotal situations where individuals have the owners, not in San Diego or California, but in other states, two owners in a hair salon became infected, and even with that, because of the barriers in place, none of their over 100 patrons tested positive. So again, we're following the evidence and the science. Thank you.
Thank you. And my next question isn't just for Dr. Wooten, but in general, I was wondering if anyone has any regrets now that we have to go back on some of the reopenings about how the reopenings have been handled so far and what was learned moving forward that might be applied 3 weeks from now.
Well, San Diego has done an excellent job, I feel, with everyone's cooperation, and we were actually, as you may or may not know, one of the last counties to be included in the now 23 counties that are under the governor's restrictive measures. We can't look back. We have to move forward and learn from our lessons, and again, let the science dictate our actions. Thank you.
Okay, next question.
Derek Stahl with 10 News. Please state your question.
Hi there. I have a question about diagnostic testing. So on Monday of last week, I went out and got a COVID test at the Mission Valley Stadium location to kind of see what the process is like. As of today, 7 days later, I still had not received the results. I did call the nurse line, and during this press conference, they did call me back and gave me the results. So that's great, and I appreciate it. So my question is not about me specifically, but just in general, overall, what specific obstacles is the county running into that cause these delays in reporting test results, and what would it take to significantly speed up reporting?
Okay, Dr. Wooten's going to respond.
I think, first of all, we have to measure our expectations or temper our expectations. Getting your results back, and I'm not trying to give an excuse, but getting your results back is not going to alter what you do. If you are being tested because you've been exposed or because you have symptoms, you should be at home in isolation until at least 10 days after your test was performed. Getting the test back within 6 to 7 days is actually the average. If we look at all of the various testing sites, some are much or less in terms of 2-3 days, and some are more, sometimes up to 8 days. So it's not going to change. Getting your test back sooner is not going to change what you should be doing as an individual who's been tested for symptoms. And your second,
I guess part of the premise of my question is that we had another reporter get tested in Lakeside. He got his results within 3 days.
Mm-hmm.
I got my results within 7 after. We had another reporter get tested in the Lakeside location, and he got his results in 3 days. I got mine in 7 after I called, from the Mission Valley. So what's going on at these different locations that cause these disparities?
The different locations is the lab testing. When you have all of the tests coming in, as you may have seen during my presentation, the numbers have increased. So with increased numbers, there's increased testing, and it's about resources and the ability, if you have a large number of tests, we would have to increase, and we have done that, increased our staffing capacity. But we have Nick Mascione here, who would like to make additional comments as the lead for our testing, tracing, and treatment strategy.
Thank you.
Thank you, Dr. Moon. Thanks for the question. So I think really the point about the testing is that there's a number of groups that are doing testing. We have, and the Supervisor Fletcher noted, pretty heroic efforts by the hospitals expanding their testing. We have one clinic doing testing. There's also state sites that are doing testing using commercial labs, and then there's the county sites. For the county, a number of weeks ago, we had a machine that went down, created some delays, we got caught up. Currently, we're about 3 days for the county. For the state testing sites, we are hearing things of getting up to 5-7 days, and we are trying to work with the state sites, and they're using a commercial lab. I think everyone is, though, trying to expand their capacity. For the county, I'm pretty proud of our public health lab. We're averaging about 1,500 tests a day, trying to get those around in 3 days or less. And also, very importantly, as Dr. Wooten said, ensuring that everyone's practicing the measures if you were positive as you're waiting for your results. We are prioritizing also those that are in high priority. What does that mean? For any of our case outbreaks, for those that are in skilled nursing facilities, when we're doing testing for those, the clock's ticking really quick. And so for those, we are prioritizing those to get those within 2 days or less. And so I think the ability over time as we're expanding the capability in San Diego, which I should say, for the state is kind of one of the leading counties in our testing capacity. But all counties are trying to expand that capability to do not just more tests of the right people, but also quickly as we get through. Thank you.
Okay, we'll go to the next question.
Matt Hoffman with KPBS, please go ahead.
Dr. Wooten, I know you said that we can't look back, but if we can for a second, maybe like reflect. I know 21 outbreaks in 7 days, triggers for the case rate and percentage of cases investigated. Obviously, you guys are imposing these new restrictions, but what do you think happened to let us get to this point? I mean, like, is this because of bad actor businesses not following the rules or people not doing enough themselves? Any trends you guys are noticing that got us to this point?
Okay, Dr. Wooten's here.
Yeah, and this is not about pointing fingers. We knew we would have more cases as we opened up. So that is one of the primary reasons or drivers for why our numbers are increasing. Also, as we reported last week, most in the past 14, or actually in the past month, most of our cases have been in the age group from 20 to 39 years of age, about 48%. In addition, about 25% or plus are in our south region as well as our central region, which is south region in particular is the most populated area within the county. So as we open back up, it is actually quite simple. We open back up, people are out feeling comfortable and feeling as if they can just get through life as they did before COVID-19, not wearing facial coverings, not social distancing. And when you do that, you are at risk for developing COVID-19, and that's what's happening, particularly in our younger age group. If you recall the briefings from last week, our older populations, our numbers are actually going down, but they are going up in the 20 actually it's primarily the 20 to 29 age group, and then more in the 20, or rather 30 to 39. That's where the 48% of our cases in the past month reside. Does that?
Gotcha. And then no, that's perfect. And then just to clarify, so bars that don't serve food must close all operations, and that means like breweries. That means that they can't do curbside or to-go sales. Is that what that means?
If they, any of the facilities, if they are affiliated with a food entity, so for instance, bars can develop relationships with food trucks. But again, they still have to not serve, actually, they've not been serving as of tonight at midnight. They cannot serve indoors. They have to do outdoor dining or pickup or takeout. So that's the situation going forward as of midnight tonight.
And do you know, can that be a patio and/or a parking lot in terms of the outdoor dining?
I'm sorry?
For the outdoor dining, can that be a patio, like and/or a parking lot?
Any space that they are legally permitted to utilize, but they still have to close at 10 p.m.
Thank you.
And can I just be a little more granularity on the 10 p.m.? As long as customers are seated before 10 p.m., then, but they do have to be out of the facility by 11 p.m. Thank you.
Okay, we have one final call-in question.
Paul Sisson with the San Diego Union Tribune. Please go ahead.
Thank you. What about retail? Can I still go out and buy myself a new shirt tomorrow, or I don't think retail is affected?
Okay, Dr. Wooten's going to respond.
Paul, I welcome you to go out and buy a pair of new shoes. Retail is not affected by this guidance. Thank you.
Is that a similar reason as nail salons and barber shops? You just haven't seen outbreaks in retail settings?
Again, when you are going into retail, you aren't concentrated inside that facility as you are if you go to restaurants and bars. So we have not seen any outbreaks to date in like retail facilities as you have described. Again, following the science, they are mostly in restaurants. Businesses are also a part of that, but mostly restaurants/bars.
And then in terms of the state's per capita trigger that we have now hit, it's my feeling that we're going to be in this mode for 3 weeks, even if our per capita number drops back below 100 per 100,000. We're stuck in this for 3 weeks no matter what?
That is correct. We are obligated now for a 3-week restrictive measure, as we've explained.
And then finally, I wonder if you could say anything about enforcement over the weekend. There was a lot of talk before the weekend about increasing enforcement. Have you heard anything about citations being written, or what can you say about that?
I think I heard somewhere about 20 to 30 citations were issued over the weekend, but I think in large, people actually did quite well over the weekend in terms of the volumes of individuals that went to the beach and practicing social distancing. So I think San Diego did quite well over the weekend.
Thank you.
This is the first text question from Rachel with 10 News. Can you say how many of the people who tested positive were asymptomatic?
Well, through the end of June, 10% of all the individuals that have been tested were asymptomatic. So that's what we've seen here in San Diego. Okay? Any other questions?
Chairman Cox will answer the next one. So this question is from Alex with KPBS. Prior to the 4th of July weekend, with the state closing parking lots at state beaches and surrounding counties closing their beaches, why didn't the county make the preemptive move to close our beaches or the beach parking lots to avoid what happened this weekend?
Well, actually, the feedback we've gotten from most of the coastal cities is they were able to handle the problem. And the final analysis, the county does not have any beaches that we operate. The state made a decision to close their parking lots for a 50% capacity. We did talk with each of the cities to find out if what their directions were going to be, and the ones that got back to us basically said they thought they could handle the situation. And based on the outcome, it certainly seems like they were. I know that there were some large crowds, but from the reports we got back, I think the reports we got was that it was not unmanageable and that people were generally pretty responsive to maintaining social distancing.
And Alex has a follow-up question, Chairman Cox. This one is, the state has threatened to withhold funding because of the city's refusal to close its beaches this weekend. Will the county be affected by this as well?
Well, as I said, this county does not have any beaches that we run, so I don't think that we would be impacted by that. But at this point, the state has not forced a mandate to close beaches. I think they've left it up to the local jurisdiction. As I said, in San Diego County, it's the 10 coastal cities that have responsibilities for their beaches, and they chose to keep them open with the proper enforcement, which I think by and large they did a very good job.
This next question is from Cliff with Kogo. Even though they are held outdoors, with the number of people attending, are swap meets under any restrictive public health orders?
Okay, I'm going to let Dr. Wooten respond to that.
Thank you for that question as well. Swap meets are outdoors, and I think in the past we've shared with you that events outdoors are not as great a risk as indoor events. That's the reason why we are closing indoor bars, restaurants, but continuing to allow restaurants and bars associated with a restaurant to operate outside. And again, in swap meets, people are not gathering to the degree that one would gather in a bar. People are passing and going. So again, it's outdoors and the risk is much less.
Dr. Wooten, if you can stay up there. This next question is from Mike McKinnon with KUSI. Why did San Diego County stop recording flu cases after we passed 20,000 cases in early March? And how many of the 20,000 flu cases do you think were coronavirus and not the flu?
So we didn't stop in March. We stopped in about mid-April, which is what we typically do. And actually, April is extending the flu season. So we didn't stop anything prematurely. We followed the same process we usually do. And when flu seasons are very severe, we might go through April and sometimes into May, but typically we stop with our influenza watch. But we monitor influenza year-round, even though we do not issue an influenza watch. We transitioned our influenza watch to our COVID watch. And actually, the statistics for that, which is the symptoms presenting to an emergency department, is about now 3% for both of those.
Dr. Wooten, this next question then is from Kelly with Fox 5. Are our local casinos being asked to close?
Well, as you know, San Diego County does not have jurisdiction over casinos because they are sovereign nations, but we do work with them in terms of, we've worked with them for testing, and we also, if they are individuals that have been patrons at casinos, we monitor for any increased number of positive cases in that regard.
This next question then, Dr. Wooten, is from Lori with the Union Tribune. Regarding community outbreaks, can you tell us what proportion of restaurants, bars, are bars that serve food in these outbreaks?
During my presentation, I stated that 76%, which is 16 out of 21 of the facilities that have been identified as a community outbreak are in restaurants.
And then this is the last set of questions. These questions are from Taryn Mento with KPBS, and there's a number of questions, so be patient with me. The first question is... One at a time. We'll do one at a time. Will the county be updating the trigger dashboards over the weekend? If not, will staff be able to provide upon request the updated figures for each of the 13 triggers on Saturdays and Sundays?
So we update the triggers for the public through the week, but we still look at them over the weekend. And if they are generated, then they go out with the slide deck that is produced over the weekend as well.
And then And the next question from Taryn Minto is triggers number 3, the COVID syndromes, and 4, the influenza-like illness, don't have clear thresholds on the online dashboard. Can you clarify what they are and if the thresholds have changed since the triggers were launched?
For influenza-like illnesses, which is the number of visits to the emergency department that have fever of 100 degrees, cough or sore throat, and then the syndromic are the same, similar symptoms, fever, cough. Though they are similar, but they have increased ever so slightly by 1% over the past two weeks. So we are closely monitoring those, but typically for influenza, the cutoff is, community baseline is about 2 to 3%. Is that it? Thank you.
Well, that completes our questions for today. I know that today's news is not good news, but let's look at this as a temporary setback in our fight against the pandemic. Again, it's up to each and every one of us to reverse this trend and this course through these rising case numbers. That begins with taking personal responsibility for wearing a face covering, maintaining social distancing, and washing your hands frequently. There's frankly a lot of other steps that you can take, like limiting our trips out of the house to essential activities only. If your company allows you to work from home, please take advantage of that opportunity and telework. No step is too small, no effort is too minimal. We will hold our next briefing on Wednesday afternoon. However, tomorrow we will have a comprehensive update on the coronavirus at our Board of Supervisors meeting. The meeting starts at 9 a.m. For public reasons, it will be a virtual meeting. You can watch online at Facebook, Vimeo, YouTube, and Twitter. And if you'd like to participate, please visit the county website at sandiegocounty.gov/telecomments. That's it for today. We'll see you on Wednesday at 2:30.